feeling is that in a clinic appointment, the patient has their agenda and the doctor also has their agenda. And I think the most successful clinic appointments are when we can crosstalk between those agendas. And in order to do that, you have to be aware that the other person also has an agenda. And so having that awareness and being cognizant of that and will open up, I think, a lot of opportunities for cross communication.
Great. Kerry?
I would say the best advice that I would give to get the most out is to come in prepared with notes about what that agenda is. I personally use, my calendar app on my phone where I have, the appointment with my doctor. And then in the notes, I will, throughout the time from when I schedule the appointment until the day I actually have it, I can always go back in and add, oh, I also want to ask her about this. And, oh, I have to tell her about that. And along with that, I take pictures of things that, whether it's a rash that is most likely going to be gone at the moment I see my dermatologist, or a swollen ankle that is most likely going to be down to size by the time I see my rheumatologist again. But this way, it's not just a matter of brain fog, I forgot everything I wanted to ask you. And it's not just a matter of, well, everything looks great now. And that's not the end of the discussion. So coming in with the notes and the evidence, the data, whatever it is that you want to share, helps make that conversation go more smoothly.
That's great. And that is exactly what happens too, isn't it? Always.
We love pictures. We bring all the pictures. You bring pictures of your pets and your kids too. Bring them all.
There you go. So then I'll just tie those together, and I'm going to throw back the listen word that we all started with on here onto the table, and listening to one another. And also, how can we develop some level of confidence and feeling secure and communicating and asking for help and asking what we need, or if we don't know, and that includes the doctor as well, like being able to be open and less fearful of avoidance of communication.